right, welcome to Chiro Thoughts, where we talk about everything chiropractic and health. I'm Dr. Adrielle, and this is Dr. Justin Berlin, and we are filming this video on our Q&A. So we had some people shoot us some messages asking questions just regarding health, chiropractic, and we are here to answer them for you. So, getting started. Best daily supplements for adults and kids.
Okay. I always start off with two that I think are extremely important, which are vitamin D and probiotics. And that would be for kids or adults for strengthening immune system, increasing digestion, right? Those are the two that I would start with. And honestly, I probably wouldn't change much from adult to kids. The ones that I recommend that I take for myself and have my children take, I would also add fish oil to that as a good omega-3 fatty acid, and then a whole food multiple vitamin. So those would be my big four. So multiple vitamin D, probiotic, fish oil.
Cool. Kids and adults.
Kids and adults.
Covers everybody. Alrighty, next question. Is it best to have a massage before or after an adjustment?
I would say before the adjustment, personally.
Yeah.
And I think that's the way most chiropractors handle that is you get a massage, right? It helps loosen the body, muscle tissue, relaxation, and then get the adjustment. So that's what I would do.
Yeah,
I think that's
coming
best.
in here relaxed, not all tense.
Relax back, for sure.
For sure. Just the ease of movement helps a lot. Yeah. What is the worst thing one can do after an adjustment to destabilize it?
Historically in chiropractic, there were resting rooms, so you would get adjusted, and then you would rest for anywhere from 10 to 30 minutes.
Well, BJ Palmer had people resting for 2-4 hours.
Was it that long?
I think it was super long, yeah.
And so some offices still implement that, but I would probably say one of the worst things to do immediately after an adjustment would be to be super active, right? Like you want to allow your nervous system to go through a healing process and healing cycle. So as opposed to creating more stimulation, so I mean, again, I don't think it's a horrible thing to get adjusted and then go exercise, but you're probably also not going to create the most amount of healing. Worst thing would be any kind of trauma, I would think, especially repetitive trauma. But yeah, I mean, I think you're better off getting adjusted and having trauma than not. So I wouldn't be
when you're talking about trauma, you're talking about micro traumas, essentially. Just
sitting at a desk with your head down.
Staring at your phone.
Staring at your phone, right? Those types of things. Even like going for a run. Because if there's lateral misalignment, that's now creating more compression on the spine. So I think resting would be ideal. But I wouldn't overly think that one either, because you want to create. You're going to get healing no matter what. So.
Yeah, for sure. Yeah, and if you're coming in for a long time, I mean, you're in more of a wellness phase. Your spine is more adapted to the chiropractic adjustments.
Absolutely.
We're in a better place. So
depending on where you are in your care.
Where you are in your care, for sure. Alrighty, next question we have: what are the most common things that chiropractic can help with?
Do you want to answer that question?
It's so broad. I mean, literally anything that the nervous system affects, which is controlling your entire body. I mean, ears, eyes, nose, throat, digestive, heart, lungs, literally everything. What can chiropractic not help with this question?
It's kind of a trick question, right? Like you said, the question that I always ask my patients when they ask, can chiropractic help with, right, fill in the blank, I always say, does the nervous system control, fill in the blank. So the most common things that we see, and I think across the board, are the ones that chiropractors typically tend to advertise because they're the most broad, which would be pain and headaches, are probably the most common. But those are the most common symptoms, right, that patients come in with in general, because they're unaware of the vast effects that the chiropractic adjustment can have on the function of the body. But some very common things that we see are, like you said, improved digestion is big, improved sleep. Balancing of hormones, I think, is a huge one that we see a lot of. Heart, blood pressure decreasing, vision improving. These are all things that we see regularly. So really the question is, right, if your body isn't functioning wholly, you're at 100%, whatever system that the neurologic imbalance is occurring in is going to see improvement with the adjustment.
Yeah. Well said. Alrighty, next question. Do I need x-rays? If so, why?
I believe that we should have an x-ray on most patients for the simple fact that it takes the guesswork out of what we do. If our job is to correct a spine, right, biomechanically, neurologically, from its curves and its alignment, if we don't know where you are, it's hard to correct it. And the x-ray right, gives us specific information as to where the adjustment needs to take place, and then also the severity of the problem. It also helps us to rule some things out too that we may not want to be adjusting in certain cases, but the great majority of the time it allows us to be more specific. If we want specific results, we have to do specific testing.
And it's a great objective measure. Taking films at the beginning of your care, halfway through, at the end of your care, you can see objectively how your spine has improved and correlate that with subjective
that's a great point.
outcomes as well.
So not only does it be for the proper adjustment, but like you said, it helps the patient to understand, to visualize, and normally do a better job at following through with their care because they can see it. So
for sure. That was our last question. However, I do want to throw another one in that I've been receiving a lot of questions about is those decompression tables. Opinions, thoughts, do they help, do they not help? I know there was a huge surge of getting people on these tables. I just wanted to pick your brain on that.
Of course, there are a lot of chiropractors use them. A lot of people in general use decompression, and you can absolutely decompress a disc with using decompression. I think the one thing that most patients don't think about is that when there's improper loading of a disc, right, instead of two vertebrae stacked on top of each other, like they should be appropriately, right, with no lateral changes to it, that's what creates a healthy disc balance. And so we take an imbalanced disc and we decompress it. It absolutely feels better, whether you're hanging from a pull-up bar, pushing up on the countertop, people will talk about, or using a form of traction or distraction. It feels better temporarily, but then when you go back upright and you compress a disc unevenly, you're gonna go right back to that same position. So I always say if we were designed to be under distraction, decompression, we'd have tails like possums to hang upside down. And so I don't think that it can't help, but is it solving the problem?
It's not fixing your issue. It's not helping with function. It's not recreating stabilization. It's not doing any of those things.
It's a temporary fix, a temporary alleviation of disc compression, but then once you resume upright posture, you compress a disc unevenly, the problem will most certainly come back. And so it's really trying to figure out how do we load the disc while we're under compression. Discs are designed to be compressed. That's why we have them, right? They're designed to be compressed. And so it's not that the disc needs to be decompressed, it's that it needs to be compressed evenly. And that's what we're looking for. So they can help. And again, sometimes if there is no disc space left, I think with chiropractic care, it's probably the most beneficial time to add some decompression.
Cool. Alrighty, well that's all we have for you guys today. Shoot us more of your questions that you'd love for us to answer. Thanks for listening to Chiro Thoughts. Until next time.